Meet Jack. Jack is 78 and lives alone in Sunderland. He has several long-term conditions including COPD, diabetes, and has had a hip and knee replacement in the past, as well as having arthritis in his hands. He isn't very mobile but can generally get about his house and sometimes to the local shop. His only family, Josie, his sister, helps as much as she can, but is in her late 60s herself and sometimes struggles to cope. She relies on her son for transport to visit Jack, and she pops in every week to offer some company, do a bit of shopping and housework, and pick up any laundry. Jack was recently discharged from hospital after a short but serious chest infection that was made worse by his COPD. He's a lot better, but to make sure he was supported initially, the Age UK Sunderland Hospital Discharge Team, who provide basic care and support for older people when they first come out of hospital, sent Debbie along, who helps with shopping, companionship and daily checks. At a visit, Debbie noticed Jack seemed a bit disorientated, confused and agitated, and said he was feeling poorly, so clearly needed help. As a member of the new Recovery at Home team, part of Altogether Better Sunderland, Debbie made a call to the 24/7 central team. The nurse triage quickly established Jack needed a visit, and 2 nurses arrived within 4 hours. They fully assessed him and suspected he had a urinary tract infection, which, while not serious, can make older people disorientated and unsteady, as well as being uncomfortable. However, this can be easily treated. One of the nurses made a call back to the hub to establish the best antibiotics for Jack, combined with his other medication. They also spoke to the on-call social worker to arrange a care assessment, as Debbie thought he might need more help once her short-term support was over. At the same time, the hub team contacted Jack's sister to brief her. The nurses established that Jack was well enough to stay at home after they had made him comfortable and carried out all the relevant examinations. They also updated Jack's electronic medical notes, which in time will be shared with other professionals responsible for his care. The GP practice was automatically notified to allow them to monitor his ongoing health, and the social worker visited the next day to carry out the planned review. The social worker arranged for Jack's home to be assessed, and Sunderland Care and Support Reablement team soon visited to replace his stick with a Zimmer frame and gave him some equipment to help him with day-to-day tasks like making a cup of tea and brushing his teeth when his arthritis was particularly bad. The social care team also put in place a care package which included regular visiting care. Ongoing health and social care for Jack is now managed by his local Community Integrated Team, or CIT, working with his GP, who is at the heart of his care. A care plan has been put in place to ensure that he is given the ongoing community-based care he needs to stay as well and as independent as possible. He is reviewed regularly by his practice's multidisciplinary team, and if necessary, the nurses and social workers visit him together to assess his condition and make immediate changes to his care package. This is all fed back to his GP, who works with the MDT coordinator to ensure that his care is appropriate at every stage. His electronic medical notes are updated with every visit, and as the technology is rolled out, this will mean that, at any given time, his care team know how he is doing and what support is in place. The Age UK Sunderland Living Well Links worker, part of the CIT, visits Jack regularly to help advise him on other available support, like benefits advice or Age UK Sunderland companionship groups he could attend, and has arranged for a telecare alarm system to be installed. Jack's sister now also gets support from Sunderland Carers Centre to ensure she gets the right information, guidance and support to make sure she looks after herself so she feels able to carry on with her caring role for Jack. She has also been given information about the Recovery at Home service and knows she can call them day or night if she's worried about Jack. She keeps the Recovery at Home number in her phone. One night, Josie popped in, and Jack had suffered pain in his chest so severe he had fallen over. He'd pressed his alarm and an emergency ambulance had been called. Jack had badly twisted his knee and needed an urgent assessment in the emergency department. On arrival, the Recovery at Home Older Persons Assessment Liaison Team, OPAL, met with him with the hospital's emergency staff. OPAL nurses help the hospital staff to decide if someone can be supported at home. Jack had some tests carried out and an X-ray, and it was clear there was nothing seriously wrong, but together the team decided while he didn't need to be admitted, he couldn't go directly home just yet. Jack was taken in OPAL transport to an intermediate care unit where he got the extra care he needed from the nurses and GPs there. Within 2 days he was back on his feet and taken home. Jack's Living Well links worker popped in that day and had arranged for him to enjoy a day out at that week's football match. Jack's doing well and is really happy to be at home.